Greetings, dear colleagues. Thank you for giving me the opportunity to read our abstract for our study titled Psychiatric Aspects of Healthcare Workers During COVID-19 Pandemic in Surabaya, Indonesia. Prevalence of Anxiety, Resilience, Burnout, and their correlations to stress markers. The coronavirus disease, COVID-19 pandemic, severely affected healthcare services, including causing negative impacts on healthcare workers' mental health. An observational study was conducted at Dr. Stomo General Hospital, aimed to measure the prevalence of anxiety, resilience, burnout, and their correlations to stress biomarkers amongst healthcare workers in Surabaya, Indonesia, during the COVID-19 pandemic. Participants were residents who managed COVID-19 patients, chosen using random sampling. All participants had a one-week shift working with COVID-19 patients in an isolation ward. The study used online questionnaires and laboratory data at the shift's beginning and end, along with collecting socio-demographic characteristics, state trait anxiety inventory, SCAI, brief resiliency scale or BRS, and Maslow burnout inventory or MBI scales were administered online. At the same time, laboratory markers such as neutrophil to lymphocyte ratio, NLR, interleukin-6, IL-6, cortisol, and CD4 values were studied. 61 participants were included in the study. At the beginning of the shift, 59% of participants had moderate to severe anxiety, and 83.62% had normal to high resilience. The early proportion of the participants having burnout from combined MBI measures was 88.52%. MBI-EE median scores were lower in the merit group. NLR value was significantly related to SCAIS and BRS. The conclusion is most healthcare workers had anxiety and burnout with normal levels of resilience. Our study found that NLR might be useful as a marker for anxiety and resilience. Thank you for your attention.